Okay, so good evening everyone. Uy, di ba pala ako nakabihis? Sandali lang ah. Pek, pek. Oh, di ba? Uy, nawala yung aking eyeglasses. Okay. So good day for you to you guys. So this will be our first asynchronous lecture on your fluids and electrolytes. So for today we will be discussing about your fluid shifting and fluid volume deficits and the management for fluid volume deficit. After that one we will be discussing next week we'll be discussing already your fluid volume excess tayo. Okay? So ayan. So of course ngayon wala na akong kausap. Ako lang talaga nag-iisa. So mas maganda tong ganito class, no? Okay, so without further delay, I'm going to now share my screen for your fluid shifts topic and fluid volume deficit. Okay? Ayusin lang muna natin ating microphone. Okay, now, when we're talking about your fluid shifts, hindi lang, saan na ba yung ballpen ko? Okay. Okay, fluid shifts. Now, remember, what you have to remember about fluid shift is the lecture that I gave you before, yung first topic natin, wherein there's a lot of pressures that comes into play. There's a lot of solutes that regulates the osmosis or the transfer or the shifting of fluids, diba? You have there your sodium, you also have there your glucose, okay? So let's talk about first your plasma to interstitial. Okay, that means that when we're talking about plasma, this is what is this? This is basically your extracellular fluid. Okay, saan ba ito makikita itong plasma natin? That is located inside your blood vessel, inside your intravascular space. Now from the intravascular, or lilipat yan siya doon sa yung interstitial. And your interstitial, both of this one is still part of your extracellular compartment. Okay, and fluids found in your extracellular compartment, these are your extracellular fluids. It's just that dito, plasma, ang tinutukoy nito ngayon is the movement from your intravascular papunta sa yung interstitial or your extravascular sa labas ng blood vessel. And then it will be staying there. Okay, kaya nga meron tayong swelling eh. So you have there your edema. Ito talaga yung pinakauna na lalabas, or basically this is what we will be talking about kasi plasma to interstitial eh. Palpable swelling produced by expansion of the interstitial fluid volume, and it may be localized or generalized. Now there are types of pitting edema. There are types of edema. You have there your pitting or your non-pitting. Pag sinasabi, by the way, class, before we go to your pitting and non-pitting, yung localized natin, that means that it is just staying in one place. Okay? Hindi kasama yung ibang, or let's say for example, maybe it may be unilateral. Let's say for example, kung meron tayong complications of your intravenous infusion, di ba? Nagkakaroon tayo ng localized edema doon sa site. Okay, that's an example of your localized. Yung generalized naman, maghupong ka sa imuhang kamot, sa imong face, di ba? If you could still remember yung sa inyong DR rotation, no, there is it is already considered as a danger sign if you have edema sa face, di ba? Okay, so that is basically categorized as your generalized edema din. Okay, yung mga peripheral edema natin. Now, when we're talking about pitting and non-pitting edema, if you could still remember your health assessment class, yung pitting edema natin, di ba, if you're going to check for the lower extremities, you have to check for your edema as well. Kung meron bang edema na present yung patient mo. Remember that you're going to work from the lowest portion of the foot and then going upwards. Now, to check for the extent of edema. Okay, if ever man meron siyang edema. Now, what is the difference between your pitting and non-pitting? Of course, yung pitting natin, class, okay, pag pindot ni mo, ana, when you press it, but if you are, let's say for example, this is the leg, okay, you're going to press that one using your thumb, okay, pwede naman din yung mga fingers mo, pero since you will be doing like this, okay, ganon, so palpate mo yan siya, okay? So for your pitting edema, pag sinasabi natin pitting, there will be dentures, no? Merong pit na na-form and then dugay siya mo balik. And then you will be waiting for it to return then because that's how you're going to grade your edema then eh. Okay? Non-pitting naman is that meron siyang swelling. It's just that pag pindot mo nan, babalik siya kaagad. Okay, that's the difference between your pitting and your non-pitting edema. And it also depends on the cause as well. So marami tayong causes class. We will be discussing that one later. Okay? can cause fluid shifts in other vulnerable areas of the body. It is termed as yung third space shift. Yung sabi ko sa inyo before, your edema is called your third space shift or third um third space shifting. Okay, kasi nagsi-shift from your intravascular going to your extravascular or to your interstitial space. Where can your fluid shift? Okay, example, from doon sa ating pleural space natin. Okay, sa peritoneal space din natin. By the way, class, different ang pleural space sa peritoneal space. Your pleural space, saan to banda? Pleura. Asa man na? Sa lungs ninyo. Peritoneal naman, where? Asa man na? Sa abdomen ninyo. Sa abdomen. Okay? So, example of your peritoneal na shifting no, from the blood vessels or from the intravascular going to your peritoneal cavity or peritoneal space is what we call your, meron tayong tinatawag example of this one is your ascites. Okay? Ascites dahil sa ating liver problem. Kuha natin yung ating liver cirrhosis or liver failure. Ayan. Meron ka mga problema dyan sa liver mo, pupunta yan doon. Bakit? So because of the fact that if ever you have liver problems, for example, liver cirrhosis or cirrhosis of the liver, okay, ang mangyayari dyan is that the blood flow doon sa blood vessels ninyo that supplies your liver, mahina. Mahina na yung daloy ng tubig. I'm sorry, mahina na yung daloy ng dugo papunta doon sa iyong liver. That's why it will add up to the congestion. Pag mahina yun siya, magta-traffic yun sila doon, there's a possibility that there will be leakage of your fluids no from the intravascular papunta sa iyong interstitial. Okay, kasi nagkakaroon din ng weak capillaries tayo. Nagkakaroon din ng weak capillaries or leaky capillaries or fragile capillaries. Kaya nagli-leak yan sila doon. And remember that if ever the blood flow going towards your liver is slow, it will build up arterial pressure as well or pressure in your blood vessel. And now that pressure will contribute to the leaking of your fluids papunta doon sa iyong peritoneal space or your pleural space. Okay? Now, the major causes of edematous state, let's now talk about this one. Nasabi ko na to yung liver failure, explain ko na kanina. Burns din natin, mag-shift yung fluids natin papunta sa labas. Okay? Another one because pag sa burns, diba, remember class, burns, there is tissue injury. Now, depending, basta tissue injury pa rin yan. Remember that in your tissue injury, meron tayong vasodilation. And there will be an increase in the permeability of your blood vessel. Kaya magli-leak din yung ating mga fluids. That's the explanation there. No? This is for your decreased colloid osmotic pressure in the capillary. Pag sinasabi natin colloid osmotic pressure, that means that humihina ngayon yung pressure that would really pull, diba? That would really pull the fluids from the interstitial space. It will just stay there. Diba? Yung aking lecture before, diba, remember that one of the factors that would pull the fluids from the interstitial going back to your intravascular is ano, yung protein natin, yung albumin natin. Kuha natin, ayan, decrease ang osmotic pressure. Diba? Remember that as the solute decreases, magdi-decrease din yung ating osmotic pressure. Solutes such as your sodium or your protein, no? Ayan, or even your glucose. Increase capillary hydrostatic pressure in cases of your congestive heart failure. Now, if you could still remember yung sabi ko kanina that you will be having leaky capillaries as well or anong tawag dito? Because of the pressure no, of your blood vessels, magli-leak din doon yung ating mga fluids. Okay, that is for your congestive heart failure. Okay, example of your increased capillary hydrostatic pressure. Okay. Next is increased capillary permeability because of tissue injury. Lumalabas dyan yung ating mga enzymes or hormones, no? Not really hormones, I'm sorry. Enzymes that would, or chemicals, okay, that would influence no, the shifting of your fluids, okay? So meron tayong mga bradykinin, yung mga kinins natin, okay, those are the examples that would increase the capillary permeability. Now remember, for your tissue injury, meron tayong, di ba, redness, swelling. Now that swelling will explain yung ating shifting doon. Okay, because of your bradykinins, okay, or yung mga kinins natin or kinines. Okay. Lymphatic obstruction or increased intestinal colloid osmotic pressure. Example, surgical removal of your lymph structures. Okay, so there will still be shifting of fluids dyan. Next, now let's try to manage your edema. Paano ba ito minamanage? Of course, diuretic therapy tayo dyan. Okay? Remember, ano tawag ito? Another way or in your diuretic therapy can be given together with your hypertonic solutions. Di ba yung sabi ko before? Okay? Para hindi mag-congest yung kanilang blood vessel. Okay? Para hindi mag-congest doon, no, sa blood vessel or sa arteries or sa veins mo. Okay? Need the kailangan ng diuretics para ma-excrete yun siya. Okay? Elevating affected extremity. Yes. Okay? This is now to relieve pressure. Okay? Para then it also helps in the circulation of your blood. Kasi kung nakababa lang yun siya, let's say for example for your lower extremities, mahihirapan umakyat ulit yung dugo, yung the flow of your blood, no, doon sa veins papunta sa iyong inferior vena cava para papunta sa heart. Yan siya. Okay? So you have to elevate the affected extremity to help, no, in the gravity. Okay, and then that would lead to relieving the pressure. Elastic support stockings in the morning. This will now add up to the pressure, no, para hindi magstay or para hindi mag-leak doon sa lower extremities yung ating mga fluids. Okay, coming from the intravascular, ha. And you also have there your albumin, okay, or your human albumin or your albumin 4. This is now to increase the osmotic pressure or your oncotic pressure. Okay, or your colloid. Okay, oncotic pressure. Or pwede yan siya, osmotic, same lang magyapon na sila class. Fluid shifts interstitial to your plasma. So kanina from the intravascular palabas. Ito naman from the extravascular or from the interstitial, papasok naman ulit tayo dito sa ating intravascular. Kuha natin. So ito, interstitial to plasma or intravascular. No, sa loob ng ating blood vessel. This is the movement back of edema to the circulatory volume. Example of this one is excessive administration of hypertonic solution. This is what we have to monitor if ever we're going to correct edema. No? Remember, di ba, ang edema natin, that's the reason why we are giving hypertonic solution, because it is a volume expander. At the same time, it will now pull or increase the oncotic pressure. No? It will now pull the fluids from the interstitial papasok or pabalik sa ating intravascular o sa ating blood vessel. Okay? So ayan. So this is one of the examples bakit nagkakaroon ng interstitial to plasma shifts. Two types of fluid imbalance. So let's talk about the fluid impairment already. You have your fluid volume deficit, which we will be discussing ito next week na ito, yung fluid volume excess. No, madali lang talaga actually yung logic dyan. Pag fluid volume deficit, that means kulang ka, no, sa fluid mo. Okay? Because there is deficit. Pag fluid volume excess naman, sobra-sobra. So what are the manifestation of your fluid volume deficit? Of course, you have their dryness, weakness, okay? Pag dito naman, you will also have their hypotension kasi nga decreased blood volume ka eh. For your fluid volume excess, you have their increased blood volume, hypertension, increased BP, okay? Tapos meron pang edema din or swelling, ayan. So those are the manifestations of your fluid volume excess. So both types can be life-threatening, of course. Kasi nga, for your fluid volume excess, yung sinabi ko nga sa inyo, yung hyponatremia ninyo because there is hemodilution of your sodium. Okay? And often seen in acute care settings. Pag sinasabi acute care settings, this is your ER, NICU, mga NICU ninyo, ICU. Okay? Kuha natin. Ayan. Okay, CCU. Mga intensive care units natin dyan. Now let's talk about your FVD or your fluid volume deficit. It is a decrease in your intravascular or interstitial as well, or intracellular fluid in the body. Okay, so it does not only occur sa kuan natin sa ating blood vessel, but basically sa lahat ng spaces natin. May it be the intracellular compartment or your extracellular compartment. The cause of this one, since we're talking about fluid volume deficit, kulang tayo, kulang. Okay? Excessive fluid loss. Paano ba to? vomiting, diarrhea, no, brought about by your acute gastroenteritis, yung sa mga pedya natin na clients. Insufficient fluid intake, wala masyado tayong iniinom ng tubig, sige lang tagkape, it could cause dehydration baya. Okay, because your coffee is a form of what? Diuretic. Okay? So meron niya siyang diuretic properties. Okay? Failure of regulatory mechanisms such as what? Okay, fluid volume deficit tayo dito. Pag meron tayong hyposecretion of your antidiuretic hormone, no? Sige kag ihi ana, you will be having polyuria. Okay? Kung hindi nag-work yung thirst or yung regulatory or yung thirst regulation ninyo. Okay? And then ano pa ba? Cortisol. Pag mababa masyado yung cortisol natin, okay? Remember that your Addison's disease, di ba? Payatot masyado. Okay, that is still an example of your failure of regulatory mechanism. Okay, a relative common problem that may exist alone or in combination with other electrolyte or acid-base imbalances. Now, these are the types of your fluid volume deficit. Meron tayong tinatawag na ISO o smaller fluid volume deficit. That means that yung sodium nyo and water equal amounts ang nawawala. Okay? It's not just water alone. Kasi remember ninyo, in my previous discussion about your antidiuretic hormone, pag meron kang SIAD, di ba what happens in your SIAD or in your syndrome of inappropriate antidiuretic hormone secretion? Ano mangyayari? Di ba? How do you call this? There will be increased water retention. Tapos, ang mangyayari doon is meron magkakaroon ng hemodilution. Okay? Pero dito, both your sodium and your water will be lost in equal amounts. Kaya siya tinatawag ISO. Okay, equal yan sila. ISO or smaller. So basically, there will be no change in the osmolarity, no, concentration of your blood. No, same ra gihapon na sila. Next is your hyperosmolar fluid volume deficit. Pag sinasabi natin hyperosmolar, remember, tumataas yung concentration ng ating osmolality. Okay, that means that the concentration is brought about by the rise of your solutes or of your solute particles. So ang nawawala dito is what? Mas maraming nawawala na tubig dito compared sa inyong sodium. Okay, resulting in higher serum osmolality than normal. Okay, kung sa ISO, both of them are being lost in equal amount. Hyperosmolar fluid volume deficit is that yung fluid lang, yung water lang mismo. Okay, kuha natin. Ayan. Kaya hyperosmolar. You also have here your hypoosmolar, which is a very rare case lang talaga. Occurs when electrolyte loss is greater than fluid. Okay? Kung doon sa examples natin, it was talking about sodium and water. Here, another example here is kung mas mataas ang loss ng inyong sodium compared to your fluid or to your water. Kaya nga nagkakaroon ng hypo or smaller fluid volume deficit. Okay, kuha natin. Now, let's talk about the etiology. We're talking about etiology, that is the cause kung bakit nagkakaroon tayo ng fluid volume deficit. Okay, so sa ating etiology, you have here a lot. No, you have here your vomiting, diarrhea, GI suctioning. Sir, ano pa bang nangyayari sa GI suctioning natin? Of course, because your GI is being, the contents of your GI or your gastrointestinal is being suctioned. Okay, nawawalan tayo ng mga nawawalan tayo ng fluid. Okay? Intestinal fistulas. What is this intestinal fistulas? Ito. This is basically your intestinal fistula. Okay? Ano bang nangyayari dyan? Bakit tayo nagkakaroon ng fluid volume deficit? Kulang ha? Bakit tayo nagkakaroon ng kakulangan sa tubig pag meron tayong intestinal fistulas? Remember, for your fistulas, it's connecting two organs already. No, nag-create sila ng parang another pathway for that kasi nagmo-merge yan sila. As you can see here, this is your small intestine. And if you can see at the on the picture, ito siya, for sure, this is like your descending colon already. Remember, you have there your ascending colon, transcending colon, transverse colon, and of course your descending colon. And remember that your large intestines, they are the ones responsible for what? Absorption of your water. Now, pag magkakaroon ka ng intestinal fistula, unsa man ang fistula na Okay, it creates a pathway here. So hindi yan siya or your food now or yung inyong waste product which is your tae. Of course, that is basically the end point, no? So pagpunta yung bolus from the stomach, no? From the stomach pupunta yung bolus dito. Okay, tapos meron kang fistula. Instead of the bolus, no, to travel completely doon sa inyong small intestine, pwede siya mag-shortcut. Ayan, tapos pwede din dito, no? This is your small intestine, this is your intestinal fistula. Didiretso yan siya sa inyong um, descending colon. That means that, what does that imply? What does it imply, class? Meron akong narinig. Wala ka naririnig, sir. Baka may multo. Okay. So, kung papasok yan dito, of course, it will not have the right amount or the right time, the right amount of time for it to be absorbed, yung mga juices or yung mga, yung fluid or yung water doon sa bolus na yon. So, dediretso yan siya. Instead of having your bolus, no, na dumaan doon sa yung ascending, sa inyong transverse, dediretso na ngayon siya doon sa inyong descending and then papunta sa anus niyo para ma-excrete. Now, that would may really, ngayon, the problem there is that there will be now a decreased absorption of what? Decreased absorption, of course, of your water. Kaya nagkakaroon tayo ng deficit eh. Kuha natin. Ayan. So other causes, of course, diuretics kasi pampaihi. That's why we have to look out for this one. Or whenever we are going to administer your diuretics. Okay. Renal disorders as well. Okay. When we're talking about renal disorders, ito na yung ating for fluid volume deficit. Ano ba yan siya? Sayad ba yan o diabetes insipidus? Of course, it is your diabetes insipidus. Okay, yung diabetes insipidus natin kasi it increases the water excretion eh. Okay? Endocrine disorders, yung ating, ito na nga din. Okay? Because for your renal disorders, if ever guba ang atong glomerular filtration rate, no? Wala na siyang pakialam. Filter lang na siya ng filter. Ayan. And for your endocrine disorders, yung DI natin or your diabetes insipidus, excessive exercise because of course, you will sweat a lot. Okay, meron tayong mga, it will have a greater insensible water loss. Okay, hot environment, okay, can basically lead to your dehydration, okay, hemorrhage as well, of course, bleeding, no? And chronic abuse of laxatives or enemas or enemas. Ayan. Pampatae. Okay? Kaya nga if ever you don't have any constipation, bakit ka naman mag-administer or why are you going to take laxatives naman din? Okay, para sir, para ma-normal lang yung, oh no, that's not the case. Okay? You're just going to take the medication because you're trying to treat something or palliative support or palliative ang therapy mo. Other factors, inadequate fluid intake, yes, inability to access fluids. Of course, kung wala ka naman makikitang tubig, matutuyuan ka talaga. Inability to request or to swallow fluids. That is why pag meron kang problema dito, if the patient does not have the capability or the ability to drink water, okay, IV infusion na kaagad yan. Okay, ang kanilang management. Okay? Pero ang number one talaga nila dyan is yung oral. Pero kung severe dehydration na, oral plus IV infusion. Okay? You also have there your oral trauma. Again, if you have trauma doon sa inyong bunganga mo, okay, you will be having a hard time drinking it. And altered thirst mechanism. Hindi na gumagana yung thirst mechanism natin. We will not be feeling thirsty anymore, even if we are already dehydrated. Okay, so this is basically the pathophysiology, or let's say yung physiology ba, this is how your body compensates with your fluid volume deficit. Okay, so let's say you have the loss of extracellular fluid volume. So of course, magkaka-hypovolemia ka kasi meron kang decreased blood volume. Decreased blood volume is equivalent to your hypovolemia, yung volume. Okay, now next is decreased circulating blood. Electrolytes are lost along with fluid. Example of this one is this is what we call your isoosmolar fluid volume deficit. So ito yung ginagawa ng body natin to compensate. So meron na tayong fluid volume deficit dito, even here palang daan. Okay? It will now, what will happen? Serum sodium level remains normal. levels of other electrolytes such as potassium may fall. Kasi sabi ko nga sa inyo, di ba, yung sodium, the relationship of your, or the ratio, or the relationship of your sodium and your potassium is inversely proportional. Okay? Fluid is drawn into the vascular compartment, so kailangan i-retain yung ating sodium levels. Kasi nga, to help, no, in retaining your water as well, because where sodium goes, water follows, di ba? So fluid is drawn into the vascular compartment, okay, from the interstitial spaces. Ito yung mga compensatory mechanisms na ginagawa na nila ngayon para to normalize. Kasi ang problema natin dito is hypovolemia eh. Pag hypovolemic tayo or hypovolemia, that talks about the volume in our blood vessels. Okay? Now, for your body to compensate, they are now drawing water from the interstitial papunta doon sa ating intravascular just to increase the blood volume. Okay? So as you can see here, it will be drawn from the vascular compartment into the vascular compartment from the interstitial spaces or from your extravascular spaces. So this is a compensatory mechanism to maintain your tissue perfusion pa rin. Kasi remember, pag decrease yung blood volume mo, it will also follow that, how do you call this? Magkakaroon ka ng hypoxia. Okay? Kasi nga, here, to maintain tissue perfusion, pag sinasabi natin tissue perfusion, this is now talking about the level or the number of, not really number, no, the level of oxygen that is being delivered to the different parts of your tissue or to the different parts of your body. Okay, yung tissue perfusion na yun. Okay, and then eventually depletes fluid in the intracellular compartment. Pag hindi kasi ito na treat class, okay, if there are no, ito na physiology na ito, or pathophysiology, or let's just say yung compensatory mechanism na ito. This is basically just talking about your body's normal compensatory mechanism. There's no added management here. Now, if ever ma-deplete na, kasi syempre, di ba, from the interstitial, papasok yun sa intravascular just to compensate on the low or on the decreased blood volume. Pero kung sige gihapon siya loss, no, daghan gihapon siya loss, okay, it cannot compensate anymore. Ito na mangyayari. Severe fluid loss na tayo if there are no appropriate management that is being done to the patient. So magkakaroon na yun siya ng hemorrhage, okay? For example now, yung hemorrhage natin, and then of course, there will be shock and cardiovascular collapse. Kung mag-shock na, hypovolemic shock, pwede din siya hemorrhagic shock, may nana, hemorrhagic, mas dali man kumaugahan kung ako ra isa mag storya, no? Kung pwede lang ni masulod sa kuha. Okay, now, saan na ba tayo? I-hide ko muna ito. Anyways, the one is chatting naman eh. Ako na naman talagang isa nagsisynchronous. Hide floating. ECF fluid loss. Ano pala ito dito? Let me just check. ECF pa rin ito eh. So another way of explaining no, the compensatory mechanism, ito na nangyayari. Hypernatremic natremic state tayo. So the same thing, hypernatremic din yung state natin dito eh. Kino-conserve yung sodium level dito. Okay? Ano tawag ito? You have there your ADH, paano ba? Your ADH or aldosterone or for your, will be secreted, no? Coming from your posterior pituitary gland. Ang posterior pituitary gland natin will be the one to secrete your ADH while your aldosterone will be secreting your adrenal. It will be secreted by your adrenal cortex. Okay? Apil na tong kuan cortisol dito. Adrenal cortex mo ng cortisol ninyo. Aldosterone or your mineralocorticoids. Okay? So that ang effect nito pag of course, 'di ba remember your laas ninyo? Ito na yung mangyayari. Water, sodium retention, decrease urine output. Kasi nga, we are still talking about the loss eh. Same magyapon sa explanation dari class eh. Okay, nga nagduduha naman eh. Okay, so fluids are reunited from the colon as well, increased vasoconstriction sa heart as decreased blood volume is sensed by your baroreceptors. So ito, yung heart mo, lumalaban talaga tong puso natin class. No? Just to compensate with the decreased blood pressure. Para kung decreased blood pressure kasi class, what happens there is that the movement of your blood will decrease as well. So kung mag-decrease yung movement or yung flow ng blood natin, of course, delayed ang pagbigay ng oxygen to the different parts of your tissues. What happens here is that your heart compensate para ma-push niya talaga. It will now increase your what? Hydrostatic pressure. No? Push niya talaga, push. Napapagod yung heart, yung puso natin, class. Okay. Let's not resort to that. Tulungan natin yung ating heart. So fluid shift from the periphery to the circulation. And then, of course, thirst mechanism by osmoreceptor in the hypothalamus, increase water intake. If your thirst regulation is, or regulation of your thirst is normal. No? So, mo inom yun kag tubig, ana. Pero again, if you cannot see any water, kung wala talagang magagawa dyan, and then if fluid loss continues and regulatory mechanism fails, kasi napapagod na sila, DHN tayo. Sir, ano ba yung DHN? That is basically your dehydration. Gawa natin. Still the same thing with this one. Okay? Manifestation natin, rapid weight loss. That's the reason why, class. Okay? Usually, kung may mga kidney problems tayo, no, we try to weigh the patient. Okay? Kasi kung may kidney problems tayo, let's say, for example, if you have their renal failure, but this did not happen to me kasi acute renal failure ako. But if you have chronic kidney problems, no, just to make sure that the management or the treatment management that they're applying to you or to the patient is working, they are weighing the patient, okay, every day, daily, in the morning, not early in the morning, okay? So loss of 2% of body weight represents a mild with volume deficit. Basta just, ito siya, rapid weight loss. Okay, manifestation, rapid weight loss. Ano pa? Skin turgor to diminish due to loss of interstitial fluid. Okay? So, poor ang assessment niyan is, of course, you will be having poor skin turgor. What do we mean by poor skin turgor? Hindi bumabalik kaagad yung skin niya. So, magdi-decrease yung elasticity ng skin mo. Especially for the, mapapansin nyo talaga to sa mga patients na old or senile. Okay? Or senile naman hinoon eh. Elderly patients. Okay? Kasi nga, decrease na yung kuha nila eh. Yung, aside from the collagen, mababa na din yung kanilang water content sa katawan. Postural or orthostatic hypotension. You also have there your flat, nahihilo eh. Nahihilo. Orthostatic hypotension. Postural. Wait lang. Erase ko. Bakit ko ito ganito? Ayan. Okay, nahihilo yan sila. Okay? And then, flat neck veins due to falling venous pressure. Okay? Tachycardia, of course, this is a compensatory mechanism. Ito lahat sila, class. Ito naka-blue. Compensatory ito siya. This is your manifestation that your body is compensating. Okay? Compensatory. Okay? And you also have your decreased urine output din. Okay? Kasi gina-conserve nila yung water eh. Kasi nga, tuyong-tuyo ka na. Multi-system effects, you have your mucous membranes dry, maybe sticky as well. Decreased tongue size, longitudinal furrow increases. Ito yung mga longitudinal furrows natin. Okay, tapos ito. So, ano to dito? Chappy lips. Chappy means, dili na siya choppy, ha? Choppy. Choppy is kung nang manawag ka tapos putol-putol. Kani chappy kay dry. Okay? Meron siya mga cracks. Okay, decreased tongue size for the urinary. Na-discuss ko na ito. Oliguria for severe fluid volume deficit. Pag sinasabing oliguria, panagsan na lang na siya makaihi. Okay, increase urine specific gravity dahil nga there is an increase in what? Ano man? Increase specific gravity kasi ano ba yung sasayad natin? 'Di ba sasayad natin increase yung urine specific gravity niya? Mm-mm. Kasi nga, konti na lang yung tubig. So, basically, it is more concentrated. Okay? More concentrated. Hindi masyado, kuan. Yun yung makikita ninyo doon sa inyong specific gravity sa inyong urine. No? More concentrated siya. For your neurologic, you have your altered mental status. So, magkakaroon ng decreased level of consciousness yung patient natin. Pwede siya maging lethargic. You also have the anxiety and restlessness, diminished alertness or condition. Kaya nga mga lethargic natin eh. Lethargy. Okay? Possible coma if ever it will not be treated. No? Kung severe na talaga ang dehydration. Now for the integumentary, done. Nasabi ko na yun or na-discuss ko na yun sa inyo. Cardiovascular, done because it's compensatory. Done. Magbalik-balik man eh. Oh, by the way, ito. Decreased capillary refill. Okay, CRT ninyo, capillary refill time ninyo because of your dehydration din. Okay? So remember that for your dehydration, mababa yung blood volume natin. Okay? So slow talaga yan siya. slow talaga babalik yung capillary refill, di ba? You're going to press yung nail beds natin. Okay, not just here on the hands. If you're going to assess the peripheral or the peripheries, hands, or the upper extremities and the lower extremities as well. Okay? Increase hematocrit natin. Pag sinasabi natin hematocrit kasi this is a diagnostic examination. What does your hematocrit measures pala? It's basically the blood, okay, and the percentage, okay, the volume or the total percentage of your RBC. Okay? Remember, 'di ba yung blood natin? If you could still remember, no? Kasi ang hematocrit it is very important din eh. Okay? For diagnosing dehydration and even fluid volume overload, okay? Now, ang nangyayari dito is that remember that your blood is composed of your plasma and your formed elements. Diba? Yung formed elements natin, yung RBC, WBC, platelet. O, dito yung RBC natin. So here, okay, the blood here, pag meron ka kasi, and remember, yung plasma natin, 90+% of that one, okay, is what? Water yan siya. Okay? Kung meron kang fluid volume deficit, maaapektuhan talaga yung plasma mo. Sir, tanong, maaapektuhan ba yung red blood cells mo? Hindi po. Hindi yan siya maaapektuhan. That's the reason why, pag sinasabi natin increase hematocrit, yung hematocrit natin, you will be expecting na mataas yung hematocrit. That means that it is concentrated. Wala masyadong tubig doon. That means that mataas yung percentage ng red blood cells mo. Pag mababa naman yung hematocrit mo, of course, this is fluid volume deficit. This is dehydration, fluid volume deficit, yan. Okay? Or meron kang problema sa plasma content mo. Now, pag decrease naman yung hematocrit mo, it could also mean na what? Hemodilution, there is fluid volume overload, or there is anemia. Okay? We will be discussing that one later. Pero yun pa rin yun siya, yung hematocrit natin. Para pagdating natin doon, sasabihin ko naman, uy, natapos ko na to. Check na yun. Okay? Decreased venous filling as well, kaya nga nagkakaroon ng decreased capillary refill time. Okay? Potential complication, yes, na sabi ko na yan, hypovolemic shock. Kung if the problem is, kung hindi water loss, but instead blood loss, hemorrhagic shock. Okay? Musculoskeletal, of course, you will be feeling weak. Okay? Kasi nga, decrease na din yung pagdaloy ng ating dugo. Thus, the distribution of your oxygen towards the different parts of your body is decreased as well. You will have weakness and fatigue. Okay? Decreased body temperature if isotonic fluid volume deficit yan siya. Increased body temperature naman pag dehydration. Okay, kuha natin. Wait lang. Ayan. So you also have their thirst, meron kang thirst, weight loss as well. Okay? You don't have, ito yung kanilang um, percentage na ma-compute, no? Kung meron kang 2 to 5%, that would be mean or weight loss of 2 to 5%, that is mild. 6 to 9% naman yung moderate fluid volume deficit, and more than 10%, you have their severe fluid volume deficit. Kaya nga, there are times wherein during endorsement, sasabihin nila yan na mild dehydration or moderate dehydration or severe dehydration because of the weight loss or because of yung pagtimbang or yung timbang ng pasyente natin. Diagnostic, serum electrolyte, serum osmolality, hemoglobin and hematocrit. O, di ba? Na-discuss ko na yung hematocrit ninyo. Urine specific gravity and osmolality and CVP. Let's discuss one by one. Serum electrolytes. What you have to remember lang, class, this is just wordy, no? The succeeding slides will be wordy, so papaiksiin natin ito. Pag sinasabi natin serum electrolytes, ito yung mga, basically, it is drawn or your blood is withdrawn. Okay? And then from there, i-check nila ngayon yung ating potassium, yung sodium natin, yung potassium levels natin, calcium levels natin in the blood, your magnesium, your phosphate as well. Okay, kompleto yan siya. Okay? Your chloride, ayan. These are just examples, pero meron pa to, your calcium as well, no? So for your isotonic fluid deficit, sodium levels are within normal limits. Okay? And water loss naman, sodium levels are high. Okay? Kasi water yung nawawala eh. Okay, katong isotonic fluid deficit, diba, remember both your sodium levels and both your sodium and your fluid are being lost. So normal pa rin or within normal limits pa rin yun siya. Okay, decreases in potassium are common. Okay? pag meron kang fluid volume deficit. Okay, these are the expected these are the expected results, no? Expected results that you will see doon sa ating fluid volume deficit, sa ating serum electrolytes. Let's talk about serum osmolality. Again, class, you will be expecting pag sinasabi nating serum osmolality, dito na tayo. Well, ito mataas masyado eh. Ganito lang yan. Pag decrease ang ating serum osmolality, you have there two results lang talaga. Above the normal. There are two. Ay, ako. There are two results that are abnormal, of course. You have their high, above the normal serum osmolality and below the normal serum osmolality. When we're talking about osmolality, it talks about the concentration. It talks about your fluids plus your solute particles, yung mga chemical particles natin inside. Pag mataas kasi ating serum osmolality, that means that there is an increase in the concentration of what? Of your solutes. Ano ba itong mga solutes natin? You have there your sodium, your chloride, okay? Yung glucose natin. Pag mababa naman yung serum osmolality natin, that means that there is what? Dilution eh. Nadidilute yung mga particles natin. So that means that pag increase ang concentration, this is fluid volume deficit. Pag mababa naman ating pag mababa naman ating serum osmolality natin, there will be dilution of your solute particles. So this is fluid volume excess tayo dyan. Kuha natin. Yan. So you expect that if we're talking about the fluid volume deficit, dito tayo. Mataas yung serum, you will be expecting a high serum osmolality. Hemoglobin and hematocrit, ito din. Kasi naapektuhan din yung hemoglobin natin basta mababa yung ating water eh. But anyways, remember that your hemoglobin is still part of your RBC. 90% or 90 plus percent comprises your RBC. Okay, it is your hemoglobin. No? Your hemoglobin comprises 90% sa inyong RBC. Okay? And of course, remember that if ever mababa yung ating hemoglobin, yung hemoglobin, Diyos ko Lord, ano na ba to? Gabing-gabi na. Tapos merong biglang pupunta sa dito, no? Hindi ko na malayan pala, no? Tapos kayo lang, ano ba yun? Ano ba yun? Ganun. Aswang. Ay, nako. Okay, now remember that pag mababa yung ating hemoglobin count, of course, anemia. Pag mababa yung hematocrit levels natin, anemia pa rin yan. And I've talked about hematocrit already, di ba? It is basically the volume of your RBC tapos yung blood natin compared to the blood, no? Yung mga ratio nila dyan, yung percentage. Pag mataas yung hematocrit natin, that means mataas ang concentration, fluid volume deficit. Okay? Pag fluid volume deficit, mataas ang HCT. Pag mababang HCT, fluid volume excess yan siya. Kuha natin? Okay, very good. Ayan. Urine specific gravity and osmolality, I've already talking sandali lang. Oo. Na discuss ko na itong osmolality. When we're talking about osmolality class, 'di ba, sabi ko lang sa inyo pag mataas and mababa. Pag mataas ang serum osmolality natin, what do you think will happen? And pag mababa ang osmolality natin, pag mataas ang osmolality, there is what? Fluid volume deficit yan. Pag mababa, fluid volume excess. Ganun lang yan. Di ba? Kasi remember, guys, if there's loss of if there's loss of water, what do you think will happen with the concentration? Tataas talaga yung concentration ng solutes ninyo. Okay? Pag fluid volume excess yan siya, no, bababa yung ating concentration ng mga solutes natin because it is being diluted already by your fluids. Kuha natin. So, ayan pa rin yan siya. So for the specific gravity naman, it shows the concentration of all chemical particles in the urine and specific gravity and osmolality of urine increases. This is a compensatory mechanism already. Okay? Kaya nga yung sinasabi ko, tataas yung ating specific gravity dito. Okay, kuha natin. Okay, lastly, you have your CVP. And then after CVP magkuan. So mag-breaks ako class kay mura kong nabuang dire. No? Ayan. So I'm just going to pause this muna. Magbe-break muna si sir ninyo. Babalik ako in a couple of hours. Tulog muna ako. Pause. Okay, I'm back. Pinailaw ko na lang yung I turned the switch for the light kasi natatakot ako sa kulay ko rin class. Hindi ko na nakikita sarili ko. Okay, now let's go back to your central venous pressure, your CVP. Okay, this is also an equipment no para aside from measuring the pressure or aside from determining ito talaga one of the purpose of your central venous pressure when you're trying to do this procedure or when the patient is for CVP insertion is that it really checks for the fluid content ng ating katawan. Okay? So, ang nangyayari dito, aside from that purpose, no, pwede din siya kasi, how do you call this? You have there your IV solution din. Okay? Pwede ka maka-infuse ng IV solution with your central venous pressure as well. I will be showing you that one later. So this one measures the mean pressure in the superior vena cava or right atrium, providing an accurate assessment of fluid volume status. Ito to yung number one purpose. Bakit kinakabitan? Okay? Aside from baka they're having a hard time finding the vein of the patient kasi nga, let's say for example, kung dehydrated yung patient or there is some fluid volume deficit and then it's very hard for them to secure a line or a peripheral line. So nagkakaroon ng central line tayo dito. That's one of the example of having a central line sa ating patient, yung CVP natin. Okay? So the normal CVP is 2 to 6 millimeter mercury. Okay, kasi pressure pa rin ito eh. We're talking about the pressure here. Now, ito lang yung tatandaan niyo sa CVP class. Pag mababa yung ating CVP below the normal level, what do you think will happen? Or what do you think is the implication of that one? FVD, and short fluid volume deficit. So as you can see, if you have here hypovolemic shock from hemorrhage and then fluid shift or dehydration, mababa yung CVP natin. Okay? We will know mamaya kung ano yung nagpapataas ng CVP natin. Okay? So your negative pressure breathing will also decrease your central venous pressure. Pero pag sinasabi natin positive, okay, pressure breathing, yung mga positive pressure breathing natin, this is basically a breathing wherein kailangan na ng mask, no? Yung may mga oxygen mask or ventilators, no? Commonly sa mga ventilators natin. Okay? Now, pag positive pressure, pag negative kasi bumababa yung ating, it decreases, your CVP decreases. Pero pag ventilators naman or positive pressure breathing, okay, with the use of your ventilators, tumataas kasi yung thoracic, okay, pressure. Pag tumaas itong intrathoracic pressure, of course, you will be expecting na tataas din yung ating central venous pressure. Okay, so negative pressure breathing which occurs when the patient demonstrates reactions or mechanical negative pressure is which is sometimes used for high spinal cord injuries. Okay? So dito kung positive pressure yan tataas yan, kung negative pressure naman bababa yung ating CVP. Pag you have fluid volume deficit, bababa yung ating CVP natin. Okay? Below the normal. Okay, pag naman mataas yung ating CVP measurement, that means that there is fluid volume excess dyan. Kuha natin. So, yun lang talaga, fluid volume excess and fluid volume deficit lang talaga. So, kung ano yung makikita mo na result doon, kung mataas yun siya doon sa fluid volume deficit, for sure, bababa yun or mababa yun siya sa fluid volume excess natin. Okay? So, CVP increases with sabi ko na ito siya, heart failure or PA or stenosis. Okay? Which limit venous flow and lead to venous congestion. So that would build up what? I-increase yung ating pressure sa ating blood vessel, increase arterial pressure, or increase ang ating pressure sa blood vessels natin. Okay? Positive pressure breathing then or and straining. Kana bitaw mag-utong kana. So that would increase your CVP. Okay? So yung positive pressure breathing natin, yung sabi ko sa inyo kanina with the use of the ventilators or yung mga mask natin, oxygen mask, ayan, kasali yan siya doon. It would really increase the CVP. Okay? Hindi na masyado gaano kataas pero it would really give rise to your CVP. Okay? Now, Okay. Ito siya, saan ko ba 'to ilalagay? Dito ko 'to ilagay kasi para long, ayan. Dito. Oh. Dito sa mukha sa patient. Okay. So as you can see class, balik tayo dito sa picture ha. Remember that the zero here dapat aligned yan siya talaga dito, no? If you can see here na yung 0 point niya, dapat it should be aligned kung saan yung nakarest yung inyong heart. Okay? Yung puso ninyo. Okay? Para doon talaga or that would give an accurate measurement of your CVP. Now remember I told you kanina class that your CVP also can, okay, can include your intravenous infusion. Okay, kasi you're opening a central line eh. Okay? So you have here, ito yung tinatawag natin na three-way stopcock. Okay, this is your CVP. Tapos dito yung three-way stopcock natin. No? That means that if you're going to turn the stopcock in a particular direction, it will close some or it will close areas dito sa ating IV infusion. Let's say for example, ito yung ating kuan. Three-way stopcock, okay? This means that close to siya. That means that kung close ito siya, this part here will not be filled with your IV solution. So yan siya, when we're talking about CVP, kasi when we're talking about CVP class, meron tayong tinatawag na CVP monitoring. Okay? Depending on the doctor's order, kung kailan niya siya ipapa-CVP monitoring. Maybe every 2 hours or maybe every shift or every 4 hours, every shift, no? Depending on the doctor's order. So that's the only time we're in gagalawin na ninyo yung ating three-way stopcock. Kaya nga tinatawag siya three-way stopcock because there's a way dito para ma-close, there's a way na ma-close ito, and then ma-measure mo yung CVP ng patient, and there are times wherein ma-close ito dito banda papunta sa patient para ma-fill itong ma-fill in ng solution mo itong ating CVP dito na device. Kuha natin. So again, your three-way stopcock, okay, is the one responsible for closing no yung pathway. Okay, pag ang ating three-way stopcock is andun no nakaturo doon sa ating CVP device, that means that papasok yung ating IV infusion dito papunta sa patient natin, and then that's the time wherein you can regulate. So mare-regulate nyo din ito yung ating IVF solution depending on the rate that is being ordered by the doctor. Maybe 100 cc per hour, 120 cc per hour, depende na lang din yun. Okay, it's just like having a or it's just like regulating an IV infusion talaga. Kasi IV infusion naman talaga ito eh. Okay? Next is that if ever ready ka na mag-monitor ng CVP natin, we have kasi by default wala talaga itong kuan dito, fluid dito. Okay, so you're going to fill it in with or fill it up. Fill it up with fluid. So paano yan siya? So you're now going to close ito. Manometer. Dito. You're going to close now papunta doon sa patient mo because you are now trying to fill up this kuan dito, this CVP here, yung cylinder. Cylinder na siya class sa tube. Class, okay? Make sure na kung i-fill up ninyo itong CVP natin, hindi mahulog or dili na mag-over ng inyong pag sulod ana. Okay? So you will just be giving or infusing or filling it up with a desired okay volume, no? Kaya naman po na siya i-ball para to measure kung kutob asa. Okay? Mura na siya kuan class kana bitong inyong O2 inhalation wherein nanay ball dira wherein you can check. Pero dito yung level ang chine-check natin, yung level ng ating IV infusion kasi papasok yan siya, of course naka-close yan siya. Dito na tayo class ha. We're done with this one. Tapos andito na yung monitoring. So dito na tayo class. Okay, so naka-close yung papunta sa patient. Pag once naka-close yan siya, i-open mo ngayon ito, i-regulate or i-open mo ito ngayon, yung clamp mo dito, yung regulator mo, okay, para ma-fill up mo ito dito banda. Okay, so i-close mo din ito muna before mo siya i-adjust yung inyong stopcock papunta sa patient mo kasi sa patient mo is closed eh. Para mabantayan nimo ba kung musaka na siya. Okay, dili nang pag-close nimo pagtanong nimo, hala, taas na kaayo di ay. Okay? So pag you close the regulator, i-switch mo yan dito, on mo yung regulator, dadaloy yan siya dito. yung infusion mo, and then you will see the level here depending on kung pila, kung asa. Just make sure that it will not spill. Okay, kuha natin. Ayan. And then, i-check mo yan ulit. Okay? And then, if nanandito ang desired, okay, what you're going to do now is you're going to turn the stopcock papunta dito. Okay? So now, the manometer will now be filling. So, papasok na yan siya dito ngayon sa iyong patient. And that's where you're going to check for your reading already. Okay, naman na siya, calibrated mo na siya dire class, naman na siya reading dire. So you're going now to read that one kasi papunta na yan siya dito eh. And this one, close na yan siya dito. So your IV infusion will not be flowing anymore, but instead the fluid inside your CVP will be flowing papunta sa patient mo. And to read, and that's the time wherein you're going to read it right now. Kuha natin. So ganun yun siya. That's how your three-way stopcock works. So andito na yan siya, no? So the container fills the manometer 10 to 20 cm. Okay, so the three-way stopcock is open so that the IV fluid from the container fills the manometer 10 to 20 cm. Then the tap is closed to the fluid bag and open to the patient fluid. So yun naman. Yung sinabi ko, ito na talaga yun. Okay? Yan. So I have tried no yung CVP once lang yung kuan ako sa when I was a student no nakita jud ko ganahan magkuan handle og mga inana nga patient dito kana mga CVP kay makulba-kulbaan jud ko ana. Pero yes, you have to conquer your fears talaga no. It's just so sad nga pandemic karon you're not able to experience, but of course you will really be experiencing this one. Okay? Kasi gina-workout mo yung limited face to face whenever pag mag fourth year na kayo. Okay? For the fourth year ngayon, of course, it will be on the second semester pa. But I don't know with you guys for the batch for your batch, basta di ay pagka first sem sa fourth year ninyo, no? Kuan na mo, mag limited face to face na mo ana. You will be placed in a bubble or depending na lang sa situation sa virus natin. Pero mahumanan ng virus nato, no? Kaning pandemic kay nag fluid volume overload na jud ta, no? Most of us nambok na jud ta. Dili man siya fluid volume overload sir kay tambok man siya. Yes, exactly correct no. So correct me if I'm wrong. I'm sorry. I stand corrected. Okay? Dili na tungod sa fluid volume overload or excess tungod na sa inyong gipangkaon. Exercise na, no? Okay. Medical management na tayo, correction of fluid loss depends on the acuteness and severity of the fluid deficit. That means that the management, how aggressive the management is depends no, on the diagnosis or on the assessment of the patient with regards to their or with regard no, to their deficit. No, kung gaano kalala yung deficit, diba? We have there your mild, moderate, and your severe. Okay? Of course, since dehydrated ka, since kulang kay deficit ka, of course, you're going to replace now the fluids and electrolytes that are being lost. Okay? Sodium primarily that have been lost. No? Ayan. So fluid restoration, kung kaya oral rehydration, kung capable ang patient, yes, go for oral rehydration. Kung severe talaga, oral rehydration plus IV rehydration tayo. But again, most cases talaga class, pag mag-IV rehydration tayo, usually hindi talaga pwede makainom yung patient natin, or if ever makainom man kailangan na talaga ng ng IV infusion kasi you're going to administer medications then intravenously as well, no? IVTT tayo para mas mabilis yung reaction or mas mabilis yung mag-take effect yung gamot natin. Okay, that's one of the purpose of your IVF din eh. I will be discussing that one later. Monitoring complications of fluid restoration. Usually kasi class, pag nabibigla natin yung fluid restoration natin, kung grabe lang masyado ka-aggressive, there are times we're in, na-correct na natin yung fluid volume deficit, magkakaroon naman ng fluid volume excess. Okay? Mabibigla yung patient natin, magbibigla yung cells natin. Okay? That is why it is very important for the doctors or for the physicians to really check kung pila yun dapat ang rate na atong ihatag sa patient. Okay? I hope you still know how to regulate or I hope you still know how to compute for your drops per minute. Okay? For your macro and micro set. Sige lang naman mo yung RLE. I think you are being taught there din naman eh. For the activities. Kaya nga meron akong ganito eh. Okay, correction of the underlying problem as well. When we're talking about correction of the underlying problem, the root cause, no, yung etiology talaga, the root cause of your fluid volume deficit. Okay, that's what this correction underlying problem means. Okay, we're trying to check for the root cause. Pag nakita na or pag they know already the root cause, they will treat the root cause. Tatanggalin nila yung root cause doon para maibalik sa homeostasis yung ating katawan or yung katawan ng ating patient. Oral rehydration natin. Okay, it is the safest and most effective, of course, treatment for fluid volume deficit in alert patients. Diba? Sabi ko sa inyo, alert patients lang. Okay? Or patients who are capable of taking fluids via the oral or via mouth or per orem. Fluids are replaced gradually, particularly in older adults, to prevent rapid rehydration of the cells. Okay? Gradual. Kaya nga, di ba sabi ko sa inyo class that you have to monitor the fluid restoration kasi there is a bigger chance or there's a big chance talaga pag mali ang pag-regulate, mali ang management, mali ang pagka-compute, magkakaroon na yan siya ng fluid volume excess. Okay? Instead nga na correct na yung FVD natin, nagkakaroon pa ng FVE. So you're going to note for mild fluid deficits in which loss of electrolytes has been minimal. So moderate exercise and more moderate. Yung mga examples natin that would, of course, would have mild losses of your electrolytes or minimal loss. Okay, so for more severe fluid deficits and when electrolytes have also been lost, example through vomiting and diarrhea, okay, remember that your vomiting and diarrhea could also cause your alkalosis or acidosis. No? Madidiscuss natin sa acid-base balance natin. Okay? Blah, 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 blah. Carbohydrate electrolyte solutions such as sports drink, yung mga Gatorades natin, o yung ORS natin, pwede rin yung oral rehydration salts natin or yung ORS. Okay? Ayan no, rehydrating solution. Kaya yung sa IMCI, not really IMCI, pwede din sa IMCI. Di ba tinuturuan kayo paano mag-prepare ng ORS o yung Orisol ninyo, yung oral rehydration salts ninyo o yung solution ninyo. Okay, kung pilang measurement sa inyong ibutang asukal, pila ka the measurement ang ibutang ninyong asin, okay, with the solvent as well, of course, the water. Okay? And then these solutions provide sodium, potassium chloride, calories to help meet the metabolic needs. Ayan. IV rehydration tayo. When the fluid deficit is severe, oh, 'di ba? Dito nakalagay severe talaga or the patient is unable to ingest fluids. Siguro may oral trauma or unconscious yung patient. Ayan. The IV route is used to administer replacement fluids. Okay? So you have your types of fluid volume deficit na we have already discussed this one. Caused by losing fluids and solutes about equally. Ang hypertonic naman, more fluids than solutes. And hypotonic naman, losing more solutes than fluid. Kaya nagiging tabang siya ba? Kuha natin. Okay, so in monitoring your complications of fluid restoration, client with severe, what is ECFVD? Extracellular fluid volume deficit. Okay, accompanied by severe heart. Ito ngayon class, okay? Magmo-monitor ka ng complications. Tapos meron kang severe heart problems, liver problems, kidney problems, okay? They can tolerate large volume no, of fluid or sodium without the risk of developing your heart failure. Kasi magkakaroon ka kasi ng congestion dyan eh. Okay, if you're not careful with that one, remember, let's say for example, kung meron kang liver problems, kung may liver problems ka, what do you think will happen? Of course, di ba, magkakaroon ka ng ascites dyan, and the flow of blood papunta sa inyong liver will be slower compared to normal. That means that mas tatamba yung dugo natin, and then it would add up pressure to your blood vessels, magkakaroon ng leaky capillaries, kaya mag-escape yung ating mga, or magli-leak no, ng fluids yung ating capillaries. No? Maunang naatay, your peritoneal cavity will be filled with fluid. That is what we call your ascites. Okay, pwede din sa lower extremities natin. Okay? Kasi if you're going to check no, yung ating hepatic blood vessels, no, doon ra jud na kayo siya. Na naman ko sa abdomen. And then remember kung slow yan siya, tapos due to the pull of gravity as well, samot kahinay na siya. So that would add another pressure doon sa ating lower extremities. Kaya doon lang sila nag-escape sila doon. Okay? Kaya nagkakaroon ng edema doon sa lower extremities natin. Okay? So ayan, you have to be careful lang talaga, no? You have to monitor the complications talaga. Kasi ang ayaw nating mangyari is yung congestion, further congestion. Again, when we're talking about congestion, we're talking about the blood volume in your blood vessels. BV, no, bad vibes, bad vibes. This is blood volume in your blood vessel. Okay? Kuha natin yan. Pag congestion, it is referring to you the blood volume in your blood vessel. Okay? Remember, pag mag-congestion, of course, that means that kung may congestion doon sa blood vessels natin, what do you think will happen? Daghan kaayog dugo dito. Okay? And when I'm talking about the dugo, the blood itself, because plasma and formed elements. Remember na ito na class niya, ito nakalimutan. Yung kinakalimutan na talaga natin dapat is yung mga kailangan na kalimutan. Yung nagpapasakit sa atin, yung mga ganyan. Da, Meresin mo, sir. Okay, monitor. So how are you going to check this one? No? For unstable clients, they need to be monitored to detect increased pressure from the fluid. So you're going to monitor the fluid volume status by the CVP insertion if ever meron man. Okay, lab values of your sodium, potassium, BUN, and your CREA. Your sodium, this is basically your sodium and potassium. Ano man ito tawag na lab examination or lab diagnostic examination? Serum. Serum electrolytes. Your BUN, ano ba to? Blood urea nitrogen. This is basically your kidney function test. Okay? And then you also have your osmolarity. Okay? And then aside from your kidney function test, napud tay kuandera liver function test pod. Okay? Yung SGPT natin and SGOT, that was the term before. Okay? Naapoy ALT, AST. Muna na siya. Ang liver function test na to. Okay? SGPT, SGOT. Or in some books, no, in updated ALT and AST. Okay? You also have to check for the urine output as well. Kasi ito siya, class, how would you know that there is already fluid volume overload? Kung ang urine output mo decrease, that means that, decrease ang urine output is decreased, that means that decrease ang glomerular filtration rate nimo. That means that your kidney, may problema tayo sa kidney ngayon. Kuha natin. Okay, kasi of course you are doing a fluid restoration. Binibigyan mo ng fluid yung patient natin. And if ever gamay or if ever dako kayo ang difference sa iyang intake, parenteral intake, compared sa iyahang urinary output, you will be thinking na, okay, siguro let's say na, okay, dehydrated tong patient na to. Sige, nag-restore pa siya ng fluid. But after some time, you're also going to check naman din eh. Kasi when we're talking about the urine output, if the treatment is better, slowly and gradually i-increase yung urine output natin because the body will now understand, okay, nagiging there's already restoration of fluids sa katawan natin. Sige. So slowly but surely umi-increase yung ating urine output ngayon dyan. Kuha natin. Ayan. So the medication, bakit binibigyan ng antiemetics? Because remember class, fluid volume deficit tayo. We are after for the root cause. Kung ang root cause ng inyong fluid volume deficit is through vomiting, antiemetics tayo. No? Sir, tanong, kailan lang ba tayo bumibigay ng antiemetics? If you have their hyperemesis. Ano ba yung hyperemesis? Grabe ang pagsuka. Pagsuka. Hyperemesis or another famous question talaga to sa mga second year, no? Yung pag mag-DR kayo. You have their hyperemesis gravidarum. Remember this one. Okay? Are you going to give antiemetic sa mga patient natin or sa mga buntis natin na mga pasyente na nagsusuka or they are vomiting? Of course not. Because remember, vomiting, it is a physiologic lang yan, normal lang talaga yan sa mga patient na nabubuntis. Okay? But if they or yung vomiting nila becomes hyperemesis gravidarum or hyperemesis na yun siya, bigay ka na ng antiemetics. Okay? You also have there your diarrheals kasi nagda-diarrhea ka, antibiotics as well kasi nga let's say for example baka yung AGE natin, okay, this is your acute gastroenteritis, okay? That is usually what happens when you have frequent vomiting and diarrhea as well, no, yung acute gastroenteritis natin. Baka meron kang nakain na masama or something like that that irritated your bowel movement kaya mabilis masyado yung bowel movement natin, okay? And for your antibiotics, it is being given to treat, let's say for example, yung mga H. pylori natin na mga infection, no, that would cause acute gastroenteritis. Okay? You also have there your antidiuretics to reduce body temperature. Okay? Bakit ba to reduce body temperature? Anyways, pag sinasabi natin antidiuretics, bawal umihi yung patient mo or it decreases the secretion of your um, or increases the secretion of your antidiuretic hormone as well. Okay? Para makorek mo, para there will be more conservation of your water. Nursing management, ito yung ating mga ginagawa talaga. No? Makikita natin sa mga nursing interventions natin for fluid volume deficit. Okay? Identifying patient risk at risk for fluid volume. Ito yung mga responsibility. And number one is you have to identify the risk, no, for the patient to be fluid volume deficit, such as ano man yung age ng patient natin. Di ba? Mas matanda, they are more prone to your fluid volume deficit. Kung meron ba yan siyang mga remember yung sa previous slides, yung mga high risk natin, yung sa age natin, kung if ever may mga operations ba yan siya doon sa abdomen niya. Ayan, kung may mga fistula, no, assessment pa rin yan siya. Okay? Identifying So we have to assess first, initiate carrying out interventions to prevent and treat fluid volume deficit. So meron ka ng assessment dito. So you've already assessed the patient. Oh, okay. So you're going now to apply the management that you have to apply now to come up with a good or to be able to meet your outcome or your patient goal. Okay, and then monitoring the effects of the therapy. So you have their INO, no, intake and output tayo. You also have their vital signs monitoring, weighing the patient and daily record. Let's say for example, fluid volume deficit ka, of course, mababa yung baseline natin. If your baseline weight of the patient is, let's just say 35 kilograms. Okay, tapos fluid volume deficit siya ha. On the next day, naging 33. On the next day, 32. Do you think that the management is working? No, it's not. Okay? No, it's not. No, it's not. Of course, it's not working. Kasi malalaman mo na nagwo-work yan siya kasi admitted na siya sa hospital tapos dapat yung timbang niya pataas yan. Okay? It should increase. Okay? Kasi nga nagre-rehydrate ka na ng patient mo eh. Ang problema natin fluid volume deficit tapos ganito pa talaga ang kinalabasan ng kanyang pag-weigh, okay? Peripheral vein filling, okay, or your CRT, capillary refill time. It should be 3 to 5 seconds. Okay? Check for the urine output pa rin. Assess for dryness of the mucus, oral care, no, to decrease comfort kasi nga nagda-dry mucus tayo. Pero as you go along with the treatment, tapos there will be rehydration, of course, you should be expecting that magiging moist na yung mucous membranes niya. Monitor plasma, sodium, BUN, glucose, hematocrit to determine the osmolality. Okay? That means kung mataas pa rin, mataas yung osmolality levels niya during that treatment, that means that maybe the body is having a hard time reacting to the treatment management. Okay, what is your goal here ba? Okay, pag i-check mo yan, no, meron siyang fluid volume deficit, normally, or initially, normally na yun, initially makikita mo mataas yung osmolality niya. Mataas yung osmolality. So as the day goes by, sige, magyapon na siya check na may order ang doktor, check na to, may monitor na to na para ma-check na to ang iyang fluid volume status. Okay, dapat niyan, day by day, nag-decrease yung value ng inyong osmolality. Kuha natin. Yan. Assess the kind for confusion as well. Is indication of ICF involvement. Okay? ICF is intracellular fluid involvement natin dito. Okay, so i-assess mo yung level of consciousness ng patient mo ngayon. Kasi 'di ba, remember that when the patient is merong fluid volume deficit, of course, it will affect the level of consciousness of the patient. Magiging lethargic yan siya. Okay? Mag-decrease ang level of consciousness niyan. Okay? Keep fluids easy and accessible. Of course, administer and monitor intake of oral fluids as prescribed. INO pa rin to. This is still part of your INO. Administer IV fluids as prescribed using an infusion pump para mas kung walang infusion pump, meron naman tayong tinatawag na Soluset. Okay? Um, kasi for the infusion pump, that is basically, ang ginagawa niya is that it will really regulate, no? Sa tamang rate talaga ng as ordered by the doctor. Okay? Wala na kay di na ka mag-anaan na og relo. Regulate ka. Uy, relo. Wala na relo. Relo, regulate ka. Ganun. Okay? So it will not be like that anymore. Yan. And monitor for indication of fluid volume overload. Ito. You have their dyspnea. Why are you having dyspnea? Because of congestion. Congestion natin dito. Sa pulmonary, there will be pulmonary congestion. Tachypnea din. Okay, tachycardia. Increased CVP, jugular vein distension. Kasi di ba pag fluid volume deficit, it's flat No, flat yung jugular vein mo, and of course, you have there your edema. Ito yung chine-check natin. No, kasi we're trying to correct fluid volume deficit. Yung sabi ko nga sa inyo kanina, yes, you were able to correct nga fluid volume deficit, pero here comes another problem of your fluid volume excess. So magda-diuretics ka na naman. Oh. So ano yung pag-balance-balance, ana. Okay? So refer accordingly to the doctor as well, no, para makagawa sila ng, of course, we are dependent on the doctor's order man din. No, we carry out those doctor's orders. But you are also there to refer any abnormalities as well as to check. No. Okay, nursing diagnosis. You have there. These are the possible nursing diagnosis for your fluid volume deficit. You have there, of course, fluid FVD or fluid volume deficit, ineffective tissue perfusion, and risk for injury. So meron dito yung mga definition niya. So you just have to read about it. So these are the possible nursing diagnosis. Okay? Asa na ba tayo? Gusto ko na matapos ito. Keep muna natin. Ay, Diyos ko Lord, 36 pa. Okay, so I'll be taking a break muna. Break muna ako. Kumuha lang tubig. Okay, IV therapy natin. Di ba, kanina na you have your rehydration. Ito, IV therapy natin. I think this was already discussed earlier, yung indications natin. Unable to drink, no? Rapid delivery of medication in an emergency situation. No, just to prevent yung ating mga hypovolemic shock or yung hemorrhagic shock natin. Patients with anemia or blood loss can receive life-saving IV transfusion and even blood transfusions as well. Unable to eat, also TPN. Okay, can have their nutritional needs met with TPN tayo. So types of infusion, meron tayong tinatawag na continuous infusion. Ano ba itong continuous infusion natin? Ito na yung sinasabi ko sa inyo, yung of course, meron kang IVF solution na nakabit sa patient mo. And remember that yung IVF infusion natin, it will only stop or it will only be terminated or discontinued if there is a physician's order. So ito yung mga example. Continuous infusion. We also have their intermittent infusion. So you have their intermittent IV lines are capped off with an injection port and used periodically. Okay? So, ito siya, IVTT lang talaga to siya. Okay? May mga times na pagsasabi natin intermittent infusion, na sila HEPLOC. Okay? Kasi intermittent ang infusion hindi continuous siya. Okay, yung continuous, pagsasabi natin continuous, that means that nakakabit talaga ito siya sa inyong veins. Okay, may it be sa metacarpal ninyo, sa phallic ninyo. Okay, depende kung asan yung site na yon. Okay, yung intermittent infusion naman natin with the use of your HEPLOC. Okay, HEPLOC tayo dito. Okay? Mas nakikita kasi itong HEPLOC pag pag home bitaw tapos nagpi-PDN lang or they have this private duty nurse, no? Tapos magi-infuse lang siya doon. Iko-connect lang niya doon yung needle sa heplock, and then ito turn on lang niya yung IV infusion. You also have there your bolus or IV push. Ito yung mga IVTT drugs natin. Okay? Intravenous therapy. Okay? Bolus drug, sometimes called an IV push or your IVP drug, is injected slowly via a syringe into the IV site or tubing port. Sa atin dito kasi buhay pa yung ating Y port. Ito yung Y port natin. Dito sila nag-i-inject. Okay, so before injecting that, of course, they will be wiping it off with they will be disinfecting it. Okay, and then inject na yun siya, and then magpo-push sila. There are also times sa labas, no? I think sa Davao Doctors Hospital, they are already practicing yung um needle-less, no? Walang needles na, no? So they will just be connecting that one. I will be showing a picture of you. I'm sorry, I will be showing a picture of that one later. So ginascrew na lang nila yan siya. Sa atin doon pa rin sa San Pedro Hospital, meron pa rin silang Y port doon. Okay? Pero sa mga first world countries, no? Sa Saudi, ano na sila, needle-less na sila. Wala na yung mga needles. Okay, para din to decrease, no, kasi meron silang mga protocols such as your infection protocol. What they're going to do there is that or what the needleless na procedure will do is to limit talaga the contamination of your ports. Okay, ayan, it can be dangerous if they are given incorrectly. Labi ka ng there are times when if you're going to inject it IVTT, there are times when yung mga medications natin dapat slow IV push lang. Ayan. Let's say for example, yung ating calcium gluconate. Okay, slow lang yun na siya. And then of course, kasi ito I experienced this one. Ako mismo yung patient. Makatulog na lang yun ng intern, no? Sige gyapon siya IV push sa iyang calcium gluconate with the monitor dito. No, katong monitor sa cardiac monitor. No, basig dahil kuan ko. Magka-arrhythmia ko ba? No, magkurug-kurug. Okay, ayan. Next is your piggyback. Sir, ano ba itong piggyback or secondary infusion? This is what we call, another term for your piggyback is your side drip. Ano, diba? Kung sa relasyon pa yan, ikaw, meron ka ng mainline, tapos naisipan mo pang mag-side drip. Huwag tayo mag-side drip class. Masasaktan lang yung mainline natin. Okay? I-discontinue na yung mainline mo. Ito kasi mong side drip. Sige, ikaw na. Okay, when we're talking about piggyback, some IV medications, such as your antibiotics, need to be infused over a short period of time. And in order for the piggyback medication to infuse, it must hang higher than the primary infusion. Ano ba yan? Ano bang itsura niyan? Okay? So this is what we call your continuous infusion. Diba? Continuous infusion talaga yan siya. Okay, tapos kung maubos na yung IV infusion mo, yung 1 liter mo or yung 1,000 ml mo, follow up ka na naman ng isa. Unless, of course, it will be discontinued or it will be terminated by the physician. Ito yung ating intermittent. Ito yung sasabi ko sa inyong heplock. Ayan. No? Kung outpatient, no, pwede ra kaayo. No? So, dira na siya ginabutang. So usually mga 7 days dapat na siya, no? 7 days. Pero may iba, it will last for 7 days. Merong iba na dapat talaga i-change na kaagad. No? Pero naman yung iba, nag-extend pa talaga. After 7 days, mga 10 days, no? Kay kapuyan sila. Kay of course, if that will be, kung hindi na patent yung heplock ninyo, of course, tatanggalin yan and then they're going to look for another site, no? Another gastos na naman, another pain na naman for the patient. No? Pero usually mga outpatient, ito mga ganito eh. Ito yung sinasabi ko na needle-less. Wala na mga needles. It's just tubes all around. Walang Y-port dito. Actually, ito yung Y-port nila eh. Yung Y-port na nila dito. Okay? Ito siya papunta sa iyong mainline. Mainline ba ito papunta? Oo, yes, mainline. Okay. Ito siya yung medication mo na gina-administer mo. I think nagfa-flushing to siya or before administering the medication, nag-flushing yan siya. But actually, you don't need to flush naman if patent naman yung ating mainline eh. Okay? So, ayan. Ito yung ating see. As you can see, walang needle. So, they're just going to screw that one. May twist lang nila yan. And as you can see doon, no, grabe. They are really practicing talaga na yung infection control talaga doon na protocols nila. Okay? Working gloves or mag-gloves sila. may iba din na nagsisterile gloves just to make sure na hindi ma-contaminate talaga yung mga tubings. Okay? Ayan. And this is what we call your piggyback. Okay? As you can see, mas mataas yung inyong secondary compared to your primary para mo flow dun na siya. Kuha natin. Ayan, this is your primary, this is your main line, this is your side drip or your piggyback. Kana siya. And then this is your Y port. Okay? Kuya po nilang Y port din no, walay needle. Duha ka Y port. Dili naman na siya. No, may times na yung sa atin kasi class, isa lang jud na siya. Ka Y port. No, gitanaw jud na ako ba? Isa sa to. Pero merong iba kasi as shown in the picture. Ayan. So factors affecting flow rates, of course, change in catheter positioning. Most of the time para di jud siya ma-dislodge or para patent jud siya always, no? Kanabi sa mga bata po, kanang lihukan man gud ilang kamot, no? So you have there yung board, no? IV board. IV board. Mura siya gina-splint pero board na siya para dili maglihok-lihok, so para maana na siya. Okay? So I think na IV board diri nga gibutang eh. Wala pa di ay. Kaya wala pa na secure. Okay? So you also have there the height of the solution and of course the patency of the catheter. How are you going to check if your IV solution or your catheters are still patent? Inaog lang na nimo, check for backflow of blood doon sa IV insertion site. Pag walang backflow, meaning barado or meaning there is a problem with the vein already, okay, baka nagkakaroon ng complication doon. Stop ka agad yan. Okay? And refer accordingly. So types of IVF solutions, you have there your colloids and your crystalloids. Okay? Anong tawag ito? For your colloids naman, ito yung advantage niya or let's try to discuss your colloids first. These are the fluids that expand the circulatory volume due to particles that cannot cross a semi-permeable membrane. They pull fluid from the intestinal or interstitial space into the intravascular space, increasing the fluid volume. Okay? So they pull fluid from the interstitial. Remember, kung kani ang imong blood vessel, tissues, or cells nimo, nucleus, interstitial space to siya, papunta dito. These are your colloids. Okay? Crystalloids naman natin, they work much like colloids, but they do not stay in the intravascular circulation as well as colloids do. So more of them need to be used. Asan ba yun dito? Max large molecules. So yung colloids natin, just to make sure lang ha. Yung colloids natin, usually, ito yung dito na yung albumin natin. Albumin. Okay, yung mga proteins natin. These are your colloids. Ang crystalloids natin, ito yung mga ganito. Okay, ito yun siya. It does not contain protein class, no? It does not. Kaya nga nakasabi dito, it lacks large molecules. So if you're going to choose between the two, no, in increasing the oncotic pressure para ma-pull talaga yung fluids from the interstitial going back to the intravascular, you have there your albumin, no, yung ating mga colloid products natin. Pero the problem here is that for the colloid products, mahal jud kaayo. 'Di ba sabi ko before sa inyo noon when I was admitted, I was given with albumin, human albumin, and it cost 5,000. Tapos meron pang extra tatlo, hindi nagamit. 15,000. Wag na lang po nabalik dito. Anyways, 'di ba ang sakit pag hindi ginagamit. Hindi nagamit, no? So yung crystalloids natin, ito yung ating mga usually nang ginagamit or nakikita doon sa hospital. Though you can also see this your colloids naman, pero it's not as common as yung mga crystalloids natin. Okay? So ito yun siya yung comparison of your crystalloids and your colloid solution. Okay? So ito yung inexpensive dito. Okay? So half-life of 30 to 60 minutes, ito half-life of several hours or days. Okay? So this is just for your own consumption class, no? Basta pag sinasabi natin crystalloid, ito yung crystalloid, yung colloid natin, ito yung mga albumins natin. Okay? So I've also discussed the types of tonicity already. Your isotonic, your hypotonic, and your iso, hyper, and hypo. Saan doon ang blood volume saan doon ang volume expander? It is your anong tawag dito? It is your hypertonic and your isotonic. Okay? Yun sila yung dalawa yung volume expanders natin. Okay? So again, just read this one. Na-discuss ko na ito. Ito rin, no? Yung mga IV solution cheat sheet natin. That is why ito, as you can see, pula. Pula ito. That means that this is your D5 water. Remember, di ba sabi ko pag D5 water, this is what? Pag nasa labas, pag nasa ganito na preparation, it is still isotonic. Pero pag once magpasok itong fluid sa inyong veins, that becomes hypotonic solution. Kuha natin, di ba yung mga hypertonic natin, yung mga D5, D10, yan, lahat yan sila mga D5LR, D5, I'm sorry, not D5 water, D50 water, kana siya mga hypertonic solution na sila. D5NSS, ana. Pero kung mga 0.9 naman, ito sila mga isotonic na yan sila, mga 0.9, okay? Or below 0.9. Okay, mga ito, 0.45 kana isotonic gapo na siya. Okay, here you have their hypotonic. I'm sorry, hypotonic. Mga 0.9, no 0.9 kana. Basta mga 0.45 hypotonic na siya. Okay? Ayan. D5NS. O, diba? D5. Hyper. D5. Hyper. D5. Hyper. Okay? So types of IV solutions, by the way, class, will just also be for your own consumption. Inad ko na lang talaga dito just for you na para ma-appreciate niyo ba? Uy, bakit may color to? No? Pagkakita pa lang ng isang clinical instructor, ano na kay D5 water dira? Okay? Kabalo dayon siya, even though wala siya nakita because it's red. Okay? Pag normal saline, okay, green yun na siya. And for your lactated drinkers, you have there your blue. Pink naman pag D5LR. Okay, types of solutions according to purpose. You have their hydrating. Okay, it replaces, of course, pag hydrating tayo, of course, it replaces your water, no? To dilute the meds and keep veins open. Pag keep veins open, this is basically KVO. At least 8 to 10 drops per minute na siya. KVO. Kapoy kayo mag-monitor, anak class. Or kapoy mag-regulate. No? Nutritional naman na tayo, it promotes faster recuperation for maintenance and for volume expander. Maintenance natin is yung ating for shock bitaw, for hypervolemic or I'm sorry, hypovolemia or hypervolemic shock. Maintenance natin dyan is hypertonic plus diuretics. Sabi ko sa inyo before. And volume expander as well. Ito. Okay. Volume expander, isotonic and hypotonic tayo. So again, volume expander natin, iso and hypertonic solutions. Okay? And ayan, let's talk about the complications of your peripheral IV therapy. This is what we call your hematoma or your bruises doon sa ating IV site. We also have there your thrombosis. Of course, hindi mo man talaga makita yung thrombosis sa labas. Sa loob man talaga dyan, pero magkakaroon yan ng redness and then you will really feel, no? Okay? Anong tawag ito? Palpate pala. So this is now the blood clot or yung thrombus natin or yung thrombosis natin. Okay? You also have there your phlebitis, yung inflammation of the blood vessel wall, and this one is, I know, pangalan. And this one is your infiltration. So there will be an escape of your fluids, no, from the blood vessels, or that means that there will be an escape of fluids. Yung movement niya mag-shift eh. Mag-escape yan siya from the intravascular going to your interstitial tissues or to the adjacent tissues kung saan meron yung inyong insertion site. Okay, infiltration. Okay? So ito yan siya. So you have here your hematoma, that is the collection of blood. Ito yung mga signs and symptoms, and you also have here the nursing interventions. Almost all of the kuan here, almost all of the interventions, once you have complications, i-remove na talaga ang catheter or i-discontinue talaga. I-stop talaga yan siya. Okay? You stop immediately. Pwede man i-stop lang yung or i-close mo lang yung regulator, refer to the doctor. Dili ng kuan. Pero usually maganda magiuban nga kuan may initiative talaga natanggalin talaga yung yung cannula, no, doon sa IV site na yun. So as you can see, di ba? Remove catheter, discontinue catheter. So you're going to apply pressure with 2 by 2, and then you're also going to elevate the extremity that is affected dito, yung sa hematoma natin. Okay, thrombosis naman natin, formation of a blood clot, and then kung wag nyo kasi yan, pag nurse na kayo class, no, soon to be nurses naman kayo, no, do not do an IV push talaga. Do not try no an IV push tapos matigas talaga masyado nya gipugos jud nimo inject to para lang modaloy na pud na no you're trying to dislodge the thrombus. It would become now your embolus, no, magiging embolay yan siya, embolus nya kung mo travel na siya, what if it gets stuck to your to your blood vessel that supplies blood to your heart, MI. Pwede din siya ma-stuck sa ating lungs, pulmonary embolism. Sige. Ayun na yung pugsa. So discontinue, pag thrombosis naman, discontinue the catheter, apply cold compress to site, and then assess for circulatory impairment. Saan? Of course, kung saan yung site naman din. Okay? I-check nyo lang din yan dyan. For phlebitis, again, discontinue na naman, applied cold compress, then warm. Okay? Ito yung mga signs and symptoms niya. Okay? Again, this is just for your own consumption. Pero please be aware of the complications talaga. And how would you know kung mauna siyang ang mga complications if you don't know the signs and symptoms? So you have to be familiar with this one again. Nursing intervention talaga is just either to stop the infusion and to discontinue and to disconnect or remove the catheter talaga. O, di ba? Discontinue catheter pa naman, na naman. Okay? And ito, apply warm compress to site for the venous spasm. Okay? It is a short pain at site showing slowing of infusion, and then apply warm compress to restart infusion in the new site if spasm still continues. So still, magdi-discontinue ka pa rin yan. Maglilipat ka ng site niyan. Okay? Now, for the local infection class, wag nyong antayin na magkaroon ng septicemia. Septicemia yung patient ninyo. Please, na ba septicemia dire? Oh, na. Okay? So I will be talking about septicemia mamaya. Okay? That means blood poisoning na already. That means nag-swim na to yung kagaw dito. Good luck na lang yun. Mamatay na yung pasyente of septic shock. Okay? So ayan, infiltration, or another word for your infiltration is your extravasation. So you just have to read about this one. Again, it is very important for you to assess, no? And ang intervention talaga is stop and discontinue. Okay. Now let's go to your systemic complication. Yay! Last now mo na jud ko. So ako og maani, hayahay ko. Kamo magtanaw ani. Mao lagi pod umutan-aw mo. Anyways, there's a counter naman din doon sa kuan sa YouTube. Makabalo man ko. Pero anyways, kung mutanaw mo, it's up to you. Kung di mo mutanaw, it's still up to you. Sige. Now, you have here your septicemia class. Remember, class, pag sinasabi natin septicemia, what is this one? Pag magkaroon ng septicemia, that means that yung mga bacteria natin na wala, it's just freely circulating in our body already kasi sa blood vessel na yan siya eh. Okay, it is already in the blood. The infection is already in the blood. Hugaw na tagdugo. That is what we call, kaya nga tawag dito blood poisoning eh. So class, ano ba mangyayari? Paano ba siya magkakaroon ng, or paano ba namamatay yung patient natin from septicemia? Okay, of course, the end stage or the, kung hindi talaga siya matreat or hindi siya maabutan ng management, of course, you will be having there your septic shock. Okay? So ano ba nangyayari dyan sa septicemia ninyo? Class, please, when we're talking about septicemia, decreased blood pressure yan siya. Magkakaroon ng hypotension. Grabe na nila ka-aggressive nito. That's why they will be transfusing hypertonic solutions or isotonic solutions. Kasi nga, they are trying to, how do you call this, help the body to compensate, no? So pag decrease, bakit nagkakaroon ng decreased blood pressure? Okay? So, i-erase muna natin ito. Murag nag-jump ko eh. Okay? So, your septicemia here, magkakaroon na ngayon ng generalized or systemic vasodilation. Sir, bakit nagkakaroon ng systemic vasodilation? It's because of the fact that hugaw na, okay? Una-una na lang ninyo sa inyong, I think wala pa man mo immuno na concept, no? Sa immuno ninyo na concept, since your bacteria are there, of course, meron tayong tinatawag na inflammatory response. Now, in your inflammatory response, one of the effects of your inflammatory response is vasodilation. Though meron tayong vasospasm, but still, you have there your vasodilation because meron din iniiwan. Okay, meron kasing iniiwan din ng mga proteins yung ating mga kagaw. Remember, it's just swimming all over your circulation. So because of that one, yung mga protein natin ng mga antigens that is being left by your kagaws or by your bacteria, okay, it will really trigger inflammatory response. So there is an inflammatory response all over your body. Kaya nagkakaroon ng systemic vasodilation na yan. Pag meron tayong vasodilation, what do you think will happen to the blood flow? Blood flow will, ano man, decrease ang blood flow niyan. Sir, bakit decrease ang blood flow? Remember, analogy natin, di ba kanang host ninyo, kanang host. Kung ilisuon na ninyo para mugamay ang buslot ana, what do you think, no? Itira ninyo sa iyong naong. Bukak. Sorry. Sorry. What will happen? Di ba the pressure is too strong, di ba? Kanang itong pino na kaayo no, gitwist ninyo ang inyong hose dira kanang mouth or kanang sa head sa inyong kuan. Head sa inyong hose. Di ba kusog man kaayo ang pressure ana? That means na pag if ever there is vasoconstriction, kusog kaayo ang daloy, paspas ang flow sa imong blood. But for vasodilation, di ba kung i-open na nimo, di ba mura na kusog kaayo, no? Pero dili siya sakit. There is no or hinay ang pressure ana. So the blood flow is decreased, no? Decreased. Tanggalon nato ning kuan be sa malibog mo. Ay, apit na, apit na. So blood flow is decreased. Pag decreased blood flow, what do you think will happen? How will it affect the other organs or the tissues? Magkakaroon tayo ng hypoxia. Okay? Pag magkakaroon tayo ng hypoxia, pag magkakaroon tayo ng hypoxia, of course, decreased oxygen levels go to different parts of your tissues, specifically sa mga organs natin, vital organs natin. Okay? If it is left untreated, grabe ng hypoxia, ano mangyayari? Organ damage. Organ failure. Pag marami ng organs, multiple organ failure. Okay? So ang reaction no para kuan blood flow is decreased. Gumagana yung heart natin. Class lumalaban talaga hanggang sa dulo, hanggang hindi ako kakanta. No, it will not happen tonight. Okay? Your heart will try to compensate for the decreased blood flow. Okay? So ano mangyayari? Magkakaroon ka ng tachycardia. Lumalaban yung puso natin, class. Lumalaban. Kaya dapat lumaban din tayo sa ating online class. Sakita na sa kong likod class, oy, yate na ni. Okay? So, that is the initial reaction of your heart. Pero, pag hindi talaga yan siya matreat, magkakaroon niya siya ng bradycardic or bradycardic na yung magiging magkakaroon ng bradycardia yung ating patient din no, in the long run. Kung hindi talaga matreat. So, multiple organ failure, ayan na. Dito na papasok si septic shock. Ayan. So, decreased blood flow, that means that decrease ang blood pressure. Okay? Hypotension. Lalaban si heart. Lumalaban. Okay? Ayan yung septicemia natin. And you also have there your fluid volume overload. Ikapila na yun ako nagibalik-balik and even air embolism as well. Okay? Kuha natin. So, you just have to read this part here. No? Just to be familiar with it. Okay? So I know there are no questions with clarification. I'm so happy. So tomorrow, I'm just so free tomorrow already kay kamo ang mabisi ani. Ambot lang po sa inyo kung tan-awon ninyo. Sige lang. Anyways, let's just say na puso kayo. Lumalaban talaga dapat. So again, this is your clinical instructor, Mr. or Sir Aldrin and Antona, signing off for your topic number 3. Yes.